Okay, the external carotid artery will ascend up the neck and branch anteriorly to the internal carotid artery, both coming from the common carotid artery. The most inferior branch off the external carotid artery is the superior thyroid artery. The next branch is the lingual artery, and then the facial artery. Branching posteriorly, you'll have the occipital artery, the posterior auricular artery, and then the external carotid artery will terminate as the maxillary artery and the superficial temporal artery. The superior thyroid artery goes to the thyroid gland. The superior thyroid artery will give up a small branch called the superior laryngeal artery, which will ascend in the neck. Also coming off the external carotid artery, we have a small branch called the ascending pharyngeal artery. This will branch medially. The facial artery has a very distinct look, and it will terminate as the angular artery. It gives off some branches along the way: the inferior labial artery, the superior labial artery, and also the lateral nasal artery. Okay, superficial temporal artery will give off the transverse facial artery. We'll continue with the maxillary artery and its branches. The maxillary artery has three main divisions. Coming off the first division is the inferior alveolar artery, which will be diving inferiorly. Going superiorly will be the middle meningeal artery. The second division of the maxillary artery are mostly going to muscles, the first branch being the masseteric artery, and then we have the anterior and posterior deep temporal artery, the pterygoid artery, and then the buccal artery. The maxillary artery will then terminate as the infraorbital artery and the sphenopalatine arteries. And this is in the third division. So off the infraorbital artery, there are two small branches, the anterior superior alveolar artery and posterior superior alveolar artery. Diving inferiorly, we have the descending palatine artery, which will give off a greater palatine and lesser palatine artery. And then we have the artery of the pterygoid canal, which will branch medially.